We're fortunate to have Deborah Kobza. She is the Executive Director of the National Health Information Sharing and Analysis Center, and she's going to be providing us with a healthcare threat briefing today. So please welcome Deborah.
Okay. Thank you very much. I hope I don't scare everybody to death. I'm going to try not to do that, but I think there's some important things that we need to talk about from a cybersecurity perspective, because we've been talking about due diligence for privacy and protecting infrastructures and personal health information from breaches. But there's another whole piece of due diligence that the health sector needs to address, and that's on cybersecurity. Working for intelligence and information sharing, as you know, per the Presidential Executive Order and the Presidential Policy Directive. So I'm going to talk about some things that are going on in the health sector that, if you haven't heard about, hopefully will kind of open your eyes a little bit, but not state the obvious, excuse me, allergies in Florida. Not state the obvious, but also give some solutions, some things that are in process now that you can become engaged in and benefit from. So, as we all know, with the horrific tornado in Oklahoma, and our hearts go out to them, there are a lot of implications when it comes to cyber threats and physical threats that you might not think about. Even including the Boston Marathon bombing. There were spam emails going out with malware attached to them, trying to get people to donate money, for criminal purposes. But also there are a lot of IP addresses and things that the healthcare sector needs to know that are out there and to protect themselves from. And the little bird's come to visit me here and wants to listen, so that's good. I kind of hate to use this picture as a metaphor, but cybersecurity is front and center for the healthcare sector. Right now, the healthcare sector is the highest breached industry and has bypassed the financial sector. So there's a lot that we need to do, and we have a really great opportunity to move from a reactive to a proactive stance. When you look at physical and cybersecurity, how the federal government works with state, city, local governments is through emergency support functions. And that determines, like during Hurricane Sandy or the Boston bombing or a hurricane in Florida or a tornado, whatever happens, how those response protocols work. And with the executive order and the presidential directive and updating the National Infrastructure Protection Plan, we need to make sure that cybersecurity just isn't represented in the emergency support function for the communications sector, but that we represent cybersecurity across all the sectors, and ESF 8 especially for public health and medical services. For each, to give you a little bit of a background on what an ISAC is and about critical infrastructure protection, after 9/11, President Bush identified 18 national critical infrastructures. Along with that, there was an assigned federal agency that's responsible for writing a protection plan, like the Department of Treasury for Financial Services, HHS for Healthcare and Public Health. Also associated with that, per the presidential directive, was to stand up information sharing and analysis centers that were private sector led, but recognized by their federal agency and the private sector to protect each critical infrastructure. There's a multi-state ISAC for state, city, local government. They're funded by Department of Homeland Security. There's an emergency management ISAC that's funded by Department of Homeland Security. All the other ISACs as nonprofits are funded by their sectors, which is very important and sustained. But there's an ISAC for supply chain, for manufacturing, for transportation, for nuclear, for electric, etc. And this kind of gives you an overview of some of the ISACs. We're all private sector led, and nationally recognized and have to be recognized by our respective federal agencies, recognized by the Sector Coordinating Council within each federal agency and the private sector, and working with DHS, and especially by the National Council of ISACs, the NCI Directorate. So what is an ISAC? In the National Infrastructure Protection Plan, it defines ISACs as those private sector-led organizations that help advance physical and cybersecurity protection by connecting external and internal partners, sector and cross-sector, and being that operational and tactical arm working with government and working with the private sector. And we all have T-shirts that say, "Don't shoot the messenger." But we work on a daily basis, 24/7. Every morning, we're on a call at 9 a.m. with Department of Homeland Security and all of the other ISACs to talk about threats and vulnerabilities for that day and what needs to be done. Has something happened in water or finance that's impacting health, or vice versa? Now, when I talked about the coordinating councils, within each one of the federal agency that writes a protection plan, they have a coordinating council, and it's split into two groups. One is a government coordinating council for state, city, local, tribal, and territorial, and then there's a private sector council that represents, like the banks, for financing, for health care, pharma, medical device, hospitals, laboratories, all the different categories of the health sector. And we work individually, but we also work together to help support response efforts, and especially concentrating on cybersecurity. For the Health Sector Coordinating Council, and if you're interested in being on that coordinating council, feel free to contact me. We'd love to have you on it because it's really your opportunity to connect in at the policy level on what's going on around security and critical infrastructure protection. HHS has divided the health sector into those 6 categories. We have 2 working groups, information sharing and research and development, and also risk and cybersecurity. I happen to chair the Cybersecurity Legislation Committee, following all the cyber legislation that's going on in Congress. Just yesterday afternoon, we had a health panel at the Bipartisan Cybersecurity Caucus over at the House of Representatives with the CIO from Johnson & Johnson and a gentleman from Kaleida Health in New York, the Emergency Management Director, to talk about cybersecurity legislation impacts to the health sector. Those intelligence and information sharing and privacy and civil liberties protections that are needed for the health sector in order for us to have a comfort level to share intelligence and things that are happening out there on your networks. Nothing to do with IP or nothing to do with anything specific to an organization, but just if you're receiving malware, if you've got activity on certain ports or IP addresses, to be able to know who do you let know to research and investigate that so you know what countermeasure solutions to take. And that's the due diligence that I wanted to get across today, because you need to protect those infrastructures and not just respond to attacks, whether they're internal or external. We also have an active shooter committee, and they've just finished developing a video on, God forbid, if any health organizations would have that type of situation. But that video will really help train those folks in health organizations what to do if an event like that were to happen. Looking at cyber infrastructures, this is an initiative that HHS has been working on with the private sector to look across both the physical, cyber, and human domain. And when you talk about risk assessment and risk analysis, and prioritize the assets that are out there in the health sector, if we do have a cyber incident or we have a physical incident that impacts cyber, because the line between physical and cyber is gone. Physical, anything happening from a physical perspective, a tornado, a hurricane, a flood, Hurricane Sandy, can impact the cyber domain as well as vice versa. So there's a lot of efforts that have been going on this for the past couple of years. With the new executive order and presidential directive, all of the federal agencies have been tasked within 120 days to provide an analysis of their cyber infrastructures within their sector. So if something were to go down, you would know and prioritize what needed to come back up first. Looking at federal cybersecurity policy and programs, in 2011, some of you might remember President Obama issued a policy directive, PPD-8, on national preparedness, and it focused on prevention, protection, mitigation, response, and recovery. There were also several policies, and this isn't an exhaustive list, but just to give you an idea, when Howard Smith was the National Cybersecurity Coordinator for the National Strategy for Trusted Identities in Cyberspace, and then, of course, NIST working and having the National Initiative for Cybersecurity Education, or NIST, which is an incredible cybersecurity framework to help health organizations with workforce development. There's a lot of excellent training that's out there that's available, and we're really pushing for a national healthcare and cybersecurity education framework that we're working on. And I'm not going to steal Kevin's thunder by any means, but the NIST cybersecurity framework that he'll talk about, and there was a launch conference on that in April, and we were on one of the panels with some of the other ISACs, but Kevin will tell you about that shortly. When we look at the health sector from a demographic perspective, it's huge. We have over 5,000 hospitals, over 2,500 pharma and medical device companies, over 2,800 biotech companies, 300,000 ambulatory facilities. Trying to get your arms around protecting the health sector for cybersecurity is a massive undertaking. And the only way that we can do that is on a state-level basis, because every state does response differently. You have to align physical and cybersecurity response from an all-hazards perspective. So that's what we're working on, to have a national healthcare and public health cyber response system in place that I'll talk about in just a second. First, I wanted to talk about some of the statistics. This was an annual data breach study that Ponemon Institute comes out with every year, and they just came out with it at the end of December, talking about the breach impact to the healthcare industry as being $2.4 million, and the average cost, looking at it on an annual basis, is $7 billion. If you look at healthcare companies that they surveyed for this, which were a little over, I think it was right around 500, 94% of them had had a data breach in the last 2 years. 81% permit employees and medical staff to utilize their own mobile devices, bring your own device, to connect to their networks and enterprise systems. Many don't have the security policies in place yet because they're working as hard as they can to implement electronic health records, to put those infrastructures in place, to address HIPAA, to address privacy. You know, the health sector is like behind the 8 ball right now. So everybody's doing a tremendous job trying to catch up and get everything in place while these attacks are starting to increase. Because the health sector being now the most attacked industry, the bad guys have figured out that all the information that they've been getting in the financial sector is sitting in healthcare. You've got not only the financial information, you've got health record information, you've got insurance information, you've got Medicare information that they can create false identities for, and it just goes on and on and on. The Washington Post did an annual study that they published the end of last year about the health sector being the most vulnerable and lagging behind like the financial sector and other sectors that have addressed cybersecurity. And a lot of it has to do with budgetary restraints, being able to fix flaws and vulnerabilities in aging technology, and having a culture of kind of sidestepping security measures. I've heard so many stories in hospitals and healthcare organizations that I go out and meet that, like, a physician will leave, he doesn't want to keep logging back and in, because he's timed out. So he's tasked a nurse to go by every 10 minutes and touch that space bar or something to keep him logged in. And then she walks out of his office or out of the exam room, and everything's open for anybody to get access to. So it's just a culture of convenience because they're running at breakneck speed to try to provide health care services. This was a quote from the Information Security Institute at Johns Hopkins University from Avi Rubin, a computer scientist and technical director. Said, "I've never seen an industry with more gaping security holes. If our financial industry regarded security the way the health sector does, I would stuff my cash in a mattress under my bed." So we've got a lot of work to do. There's been some tremendous advances in cybersecurity with health organizations that we work with, that we pass on that leading practice to other health organizations, because why reinvent the wheel when you can learn from each other? Having some of the bad actors and the perpetrators, you've got, of course, the hacktivists and the cyber warriors, the Al-Qaeda cyber fighters. Just the other day, they put out on Payspin another announcement that they were going to bring down, all of the United States. But in that Payspin announcement, when you go in and clicked on it, it had malware in it, just to open it and see what they said. So they're getting very smart at what they're doing. Of course, you've got organized crime and criminals. You've got nation states. The country of China has schools that teach people how to do cyber attacks. They can go get free training. I mean, it's a nation state-sponsored activity to steal our intellectual property, as well as other countries in other parts of Eastern Europe. And, of course, terrorism and having the internal threat, that intentional threat from insiders working within health organizations, and then the unintentional, those accidents that happen that nobody really needed to do or wanted to do, but that resulted into a breach situation. These are some other statements that have been made about financially attractive to the criminal element, as the street value is worth 50 times that of personal information, and I've got a statistic coming up on that. Healthcare data breaches, as we know, are on the rise. 1 in every 6 in 2009 was aimed at healthcare, and that's increased even more from then, of course. And then resulting from harm, which is personal financial information like I've talked about, medical identity theft, denial of medical coverage. I mean, I've heard instances of people going to the hospital or going to the doctor and then pulling up their insurance records, and there's records there when they've been treated for things that they've never done or never had, and it was because of stealing their medical identity. Those things can result in death. If a hacker can get into your medical record, and if you're allergic to penicillin and they can change it and say you're not, there's all types of things that they can do just for being malicious and mean, not that they're getting any financial gain, but there's so many things that we need to do to protect that personal health information. This is one that's pretty scary. This is an online search engine that law enforcement and penetration testers use to test and to go out and look at networks and to make sure that they're secure. The bad guys also use it. If you look at Google and how it goes out and gets data across the internet to give you information, what this search engine does, it goes out and monitors for mobile devices and wireless devices that are connected to the internet. Sitting here this morning, I went out on this website and I was able to go out and monitor and just to see if there was who here had mobile devices and who was connected to the internet. Imagine if you had an embedded insulin pump. I could, and this can be done right now. I mean, it's been demonstrated over and over again. And there's been, I know on the Homeland TV show, they had someone that got their pacemaker hacked and got killed. That can happen today. Sitting in the back of the room, if I had done that search and determined that someone had an embedded medical device, an insulin pump, and it was managed wirelessly by their doctor, I could have hacked into that, changed the amount of level of insulin you're getting, and dropped you dead on the spot and got up and walked out. That can be done today. So there's a lot of scary things, but the health sector has a real opportunity to get in front of this, but we have to work together to do it. On intellectual property, that's another one that they're after, which we all know about. Again, stating the obvious here, but the economic cost to businesses for IP theft range for $200 billion to $250 billion and cost close to 1 million jobs. Bio, pharma, and medical device manufacturers are the targets of IP theft 24/7. We work with several of the largest pharmaceutical companies, and the attacks that they have are to try to get access to their research is really incredible. So I thought this was the interesting statistic I was referring to. The street cost of a Social Security number is $1. The street cost of a financial record is 50 cents. The street cost of an electronic or a medical record is $50 right now out on the street for the bad guys. So like that tornado that was out there in Oklahoma, that's cybersecurity, and that's headed for the health sector. And we've got to turn this around because it's just going to get worse. Again, everybody's like, go away, I don't want to hear anymore. But implications we have are lawsuits, criminal charges, regulatory compliance actions, fines, damage to reputation and interest, and especially loss of public trust. That's the one thing that we've got to ensure and protect is the public trust, especially in implementation of electronic health records and their personal health information being out there. Loss of life, organizational, operational integrity, the financial systems, the data, the medical devices, environmental systems, facilities, and the medical insurance and coverage. So there's a lot that we have to protect against for cybersecurity. What I wanted to talk about was what the ISACs are doing collectively and especially individually within the National Health ISAC to identify this and engaging the nation's health sector on a nationwide basis. So as the National Health ISAC being recognized by HHS and being recognized by the Sector Coordinating Council in the private sector and the National Council of ISACs, also I've been appointed by HHS to serve on the DHS the DHS Cyber Unified Coordination Group. And that's a very important, the UCG group is very important at DHS because what they're doing is across all critical infrastructures from a cyber perspective, understanding what we need to maintain during steady state and what do we need for resources if there is a cyber attack, be it made by physical terrorism or whatever it is, we need to be covered. The bad guys can attack SCADA systems. That system that I was showing you where you can sit and see what mobile devices and wireless devices are on a system, a researcher at a university was able to use that and hack into a nuclear plant and would be able to stop the cooling of the nuclear reactor to just demonstrate that it could be done. So what we do is enable, ensure, and preserve the public trust, helping support all hazard security, intelligence, and information sharing, working directly with Department of Homeland Security, as well as getting information in from the health sector. What's going on out there on your networks? What are you seeing? So we can investigate that and do an analysis of it and give you the countermeasure solutions you need to put in place to do that due diligence to protect your systems. So it's all about early warnings and notifications. Where we're headquartered. We're headquartered at the Global Institute for Cybersecurity and Research at NASA Kennedy Space Center. And that's about when everybody looks at me and goes, aerospace and healthcare, how in the world did those two come together? With the retirement of the shuttle program, and also NASA does a tremendous amount of life sciences research on the International Space Station. It was an incredible opportunity to work with NASA personnel and to headquarter the National Health ISAC there. That picture on the lower left-hand side is where our Global Situational Awareness Center is. And then on the right-hand side is, this is the Astronaut Memorial Foundation building, which is a technology education center where we're focusing on cybersecurity research and education that includes leveraging the NIST National Initiative for Cybersecurity Education for Healthcare. Now, what we do is being that trusted entity to work with the health sector is having that secure operations and doing 24/7 all-hazard security intelligence and that two-way information sharing and getting early alerts out, getting information, leading practice, workforce education, and doing cyber exercises. We worked with DHS recently and have developed a cyber exercise that's available for everybody that would like to have it. It's free. There are 4 scenarios. One is on claims and financing. The other one is on personal health, 2 on personal health information, and then 1 on medical devices. So if anybody's interested in those, just contact me and we'd be glad to give them to you. DHS did an incredible job and we had health sector subject matter experts work with us. And these are exercises that you can use within your organizations because I want to be able to give you something that you can take away from today and you can use tomorrow in your organizations to raise the level of awareness that cybersecurity isn't just an IT responsibility. It's the business side of the house. It's their responsibility as well. I know they don't want to know the magic behind the curtain, but they need to take that responsibility and be part of it, and these cyber exercises will certainly help raise that level of awareness to where the light bulb will go off, and hopefully the CIO and CISO will get the budget they need to harden their infrastructures. And this slide right here just goes a little bit more about our capabilities, but I know these slides are available that you can refer back to. At Department of Homeland Security, where we work a lot with is with the National Cybersecurity Communications and Integration Center and the DHS National Protection and Programs Directorate. That picture on the left is the Cybersecurity Integration Center, what they refer to as the NCIC. It's a top secret facility that's here in Arlington, Virginia, and all of the ISACs work with Department of Homeland Security and U.S. CERT and share intelligence so we can get that information out to you. There's also an effort right now, if you're interested, to increase the number of folks out in the health sector that have classified clearances. So we're reaching out to the health sector for those folks that do want to get that classified level so they'll have access to the intelligence that they need to protect their systems and have the appropriate due diligence in place that they're looking at the intelligence and sharing information with the health sector to protect so you don't have a data breach instead of waiting for a data breach to happen, which we know it's not if, it's when everybody's going to have one happen. This is just an example of some of our alerts and advisories that we send out on a daily basis. Sometimes we send out more than one. We'll have alerts that come out or advisory reports or in-depth cybersecurity analysis. And I'm just going to talk to this one very briefly just to kind of demonstrate how we share information in the health sector. Over on the left-hand side is where we get all of our cyber intelligence, working with technology vendors, folks that specialize in security intelligence, including Lockheed Martin. Lockheed Martin is the most attacked organization on the face of the planet because they're the largest defense contractor. If they can't secure something, I don't know who can. So we work very closely with Lockheed Martin and gather intelligence from all the other ISACs for sector and cross-sector analysis and working with DHS in the health sector. All that information comes into an analyst that look at how is it going to impact the health sector so we can get that information out. What you see there in the middle, kind of with that orange ring around it, that's where we put and vet all of the intelligence that we have, and then we push that out to a threat information sharing portal that Lockheed Martin hosts for us over in Gaithersburg, Maryland, that the health sector can log into and to be able to share that information and talk about intelligence back and forth in a very highly secure environment. And then down at the bottom is where we are working right now. DHS just released some protocols that provide structured cybersecurity language, so we're talking apples to apples, to share that intelligence automatically. So within your organizations, if you have an incident management system, instead of for us to send an email or for you to log into the portal, we can send intelligence out at machine-readable speed, which is, that's the way we've got to move from a reactive to a proactive stance. This is the really exciting part that I'm leading and very, very excited to do. We're in the process now, working at the state level across the country, to implement a national healthcare and public health cyber response system. Now, what that includes is the intelligence and information sharing that I'm talking about, but also being able to work with health sector organizations for cyber response and leading practice. What do you need to do for a security risk analysis? What does a physician need to do for a security risk analysis? And also to have cyber first responders, just like you have emergency first responders. So in every health organization across the country, we have individuals identified as cyber first responders that they know what to do in the event of an incident, what to do within their own organization, within the health sector, across other critical infrastructures, and with government, and how does that align to physical emergency management from an all hazards perspective. Having this in place for Hurricane Sandy would have been incredible. When we were part of the response efforts, as all the ISACs were, reaching out to hospitals and health organizations, not getting in the way of the emergency first responders, but reaching out to CIOs and CISOs and asking them, do you have any unmet needs? Of course, it was generators and it was fuel. You know, our generators, we purchased them, they're not built to run for weeks, it's for hours or days. This is the first time anybody's ever called me during an emergency. How can we keep doing this? And then we started looking deeper into it across the country, and the emergency management departments within healthcare and the CIOs and CISOs in many instances don't know each other. They don't talk. So when we look at response, we've got to look at it from that all hazards perspective and include the CIOs, the technology department, because those are the infrastructures that are going to be brought up first. In Oklahoma, that devastation when they're building new buildings and putting new technology infrastructures in place, they're going to be working at breakneck speed to try to get things up and running. And that's when they're going to have an opportunity to bypass security protocols that they need to put in place. And that's what the bad guys are watching for, that they'll come in and they'll implant something on a system that may not kick off tomorrow or the next day or in 6 months, but maybe a year later, that would cascade out to all other critical infrastructure. So it's very, very important that we work together. So the cyber first responders will be annually trained and certified and part of a national communication system that we have in place. So at the push of a button, we can communicate local, regionally, statewide, nationally, to if it's just pharmaceutical, if it's just hospitals, whoever we need to communicate with, at the push of a button, we can do that. And then, like in Sandy and in Oklahoma, they have no cell towers. They can't communicate. If you tweet something, they can't see it. So we're working with public broadcasting and NPR to provide that emergency response, and if everything else goes down. So if someone has an FM radio, they know they can get situational awareness reports at certain times, tuning into NPR or, picking up those types of radio stations. And then the cyber education piece of it, which, as you all know, is huge, because you need to train people in health organizations for cybersecurity awareness. That's part of the due diligence for protecting the privacy of personal health information to ensure that you don't have data breaches, and especially to educate folks in your workforce that if they do see something from an email coming in, to report it. They're not going to get in trouble for reporting it and communicating that. So we're working to develop a national healthcare and public health cyber education framework that addresses cybersecurity from a role-based perspective. That's the only way it's going to work in healthcare. So if you're a nurse in informatics, if you're an x-ray technician, if you're the CEO, or if you're in pharma or clinical or research or whatever your role is in healthcare, what are your cybersecurity roles and responsibilities? And training them to that so it's relevant. You can't take a brush and just go across and train them in cybersecurity because everyone is still in that bubble, think it's going to happen to the next person. So we've got to make it relevant to each person in the health sector. And we're using the NIST framework from NIST as the foundational baseline to build that. To do this and to implement it, again, it's a huge 8,000-pound gorilla. Which part do you bite off first? So how we're coordinating this is we have put in place a National Healthcare and Public Health Cybersecurity Council in each state across the country that has stakeholders from both public and private sector, health sector. And we're working together with them at the state level to determine what within their state do they need to implement for cybersecurity for healthcare, for education. Some states do cyber response even differently within their own states. In Boston, for example, those townships, every township does response differently. So we've got to align the cyber response to what is needed on a national level, but the only way to do that is on a state-by-state basis and working directly with those healthcare organizations. And of course, healthcare organizations go across states because you've got health systems with, a number of hospitals. So being able to coordinate that. The command and communications and control that we've put in place is using some technology called ReadyOp, and it was used for the Republican National Convention in Tampa and worked flawlessly. A lot of healthcare organizations and law enforcement are starting to use it, but it gives you that command and control capability to contact and do communications and exercises via cell phone, text, email, secure voice, radio, so we can reach out to you and let you know what's going on in an instance. We used it for the Oklahoma tornado, where we sent out information to folks that had facilities in that area and be able to let them know immediately what was going on. That hospital that lost the first 2 floors and being evacuated, letting the health sector know if you have people or facilities or provide pharmaceuticals or things to these hospitals, this is what's happening. You need to make alternative plans. So again, it's sharing information together so we can address not only what's happening in our organizations, but it's happening, at a regional, statewide, and national level as well. So the question is, why should you engage with this? And the success of us addressing cybersecurity relies on private sector engagement. What we're implementing is private sector defined in collaboration with government. And a lot of people don't realize this, close to 90% of the nation's critical infrastructures are owned by the private sector. So the private sector has to stand up and work and put all this together so we can protect these critical infrastructures, and working in collaboration and coordination with Department of Homeland Security, with our sector, respective federal agencies, with state, city, local, tribal, territorial governments. So it's really a public healthcare and public health cybersecurity response system, because your economic health is at stake, the health of the clients and the public that you serve, and protecting that is at stake. And it all comes down to that bottom line, that due diligence, that you've put in place programs and procedures and policies to protect those systems, to protect that personal health information, and you're gathering that intelligence to take those countermeasure solutions instead of reading about it the next day in the news, and then you're trying to play catch up. So if you're interested in working with us on this, if you're interested in becoming engaged or being on the Sector Coordinating Council, please contact me. I'd love to talk to you about it more and provide more in-depth information. If you'd like to be in your state on the National Healthcare and Public Health Cybersecurity Council, That is an incredible opportunity to have a defining voice, and I would really want to emphasize that. And especially with the cyber framework and all, because I want to give NIST and DHS really some kudos here, because they are really working hard to make sure that the private sector is engaged in critical infrastructure protection. And it's like the old saying, if you don't vote, don't complain. This is really your opportunity to become engaged, have that defining voice, and benefit from all the results that are there because you're helping to define it. It's not coming to you and saying, here it is in a nice box with a red ribbon, we hope you like it. You've been a part of it and you've been defining it. So that's kind of it. If anybody has any questions, I'd love to answer them or follow up with you separately.
So we have a webcast going, and it actually is up right now. And we are getting questions over Twitter, and I'm going to summarize one of them real quick. So a lot of the information that threat information that's received usually is at a higher level of classification in many cases, and sometimes requires security clearances. So maybe a two-part question. One, for those organizations that don't have cleared personnel, how do you distill that information down in such a way that it can still be actionable without providing that classified information? And then the second part of that would be for organizations that do have personnel that have the appropriate level of clearance, how do they get engaged in this?
Okay, that's a good question. There is a lot of intelligence that's shared at the unclassified level. So there is a lot of intelligence that's available right now that goes in depth to the cyber observables, the incident, the threat actor, the countermeasure solutions, everything that you need to address having your countermeasure and incident response solutions in place to address a threat or a vulnerability that comes across. So there is a tremendous amount of intelligence that's available now. What DHS is working on right now with the presidential policy directive and executive order is looking at how they can make classified intelligence, get the information out of it that they need to, and get it out to critical infrastructure owners and operators. So that process is going on right now to improve that. And if they do have classified clearances, we can certainly connect you in with the appropriate folks at DHS, and I'd encourage, working as part of the Sector Coordinating Council to connect in at the policy level and to be part of those threat briefings that those cleared personnel are able to participate in. And they do those in person, but they also do those via secure conference call as well. So I can connect you in with that if you have interest. Is that it? Totally scared everybody to death. So bummed everybody out. So, but anyway, thank you very much.